Hello, and welcome to the Spine Surgery Preoperative Education video for the Orthopedic Spine Surgery and Neurosurgery specialties at Michigan Medicine. We'd like to personally thank you for choosing Michigan Medicine for your upcoming spine surgery. The goals for this video are for you to understand how to best prepare for your upcoming surgery, know what to expect after surgery while recovering in the hospital, understand the do's and don'ts after surgery, and ideally achieve the best surgical recovery possible. For your upcoming spine surgery, you may be seeing a neurosurgeon who specializes in spine surgery or an orthopedic surgeon who specializes in spine surgery. Both neurosurgeons and orthopedic surgeons perform spine surgery at Michigan Medicine. A list of all of our spine surgeons and advanced practice providers is available in your preoperative spine surgery booklet. This slide is your preoperative checklist. The first item on your list is to read. You'll be given informational material at your history and physical visit. One of the most important being an individualized medication list with instructions if and when medications need to be held before surgery. It's important to look at this list right away, as some medications must be held up to 1 week prior to surgery. The next item is plan. While you won't need constant care after your discharge from surgery, ideally someone should be able to check on you daily if you need any assistance in the first few days following surgery. Additionally, designate someone ahead of time who will be able to take you home after discharge. Next is how to prepare. In terms of personal hygiene, make sure to brush your teeth at least twice daily and monitor oral health. Keep fingernails clean and short. Wear clean and comfortable clothes to the hospital and bring additional clean clothes to go home in. For your home environment, have clean sheets on your bed for when you return home. Arrange furniture to create wide, clear paths for walking. Remove any clutter and trip hazards. Next is what to bring. You may choose to bring eyeglasses. Notice I didn't say contacts. Those of you that wear contacts are going to need to bring glasses, as contact lenses are too difficult to manage in the hospital right after surgery. You can bring a robe, but not pajamas. You will be in a hospital gown during your hospital stay to allow for providers to examine you and also for your IV lines. You can bring a few personal toiletries. However, the hospital does provide basic supplies. Bring your ID or driver's license, as well as your insurance card. Most people like to have their cell phones with them to be able to contact friends and family. Don't forget to also bring your charger. If you have sleep apnea and use a CPAP machine at home, we recommend bringing your own labeled with your name. Lastly, do not bring any valuables with you to the hospital. The next item is wash. We want you to wash your entire body with antibacterial soap as close to surgery as possible. For example, if your surgery is early in the morning, you'll shower the night before. If it's in the afternoon, ideally you'll shower the morning of surgery. Lastly is arrive. We recommend allowing an extra 15 to 20 minutes than anticipated to get to the hospital, especially if you're not familiar with the Ann Arbor area. This will prevent you from being late or any extra stress if you run into any traffic or construction or get lost. This next slide talks about how to prepare for surgery. First, we recommend that each of you find a support person or a care coach. Maybe that's a spouse or a child or other family member, or maybe even a friend. It's important that someone in your life knows what you are about to go through and what your restrictions and limitations will be. After undergoing surgery, the more help and support, the better. Next, it's important to stop smoking. While we all know that smoking is bad for your overall health, it particularly affects spine surgery. Nicotine of any kind, whether it's e-cigarettes, patch or nicotine gum, or vape, prevents your body from creating the fusion needed to heal. Having nicotine in the system not only inhibits bony fusion rates, which can lead to hardware loosening, but it also increases the risk for infection and delayed wound healing. Everyone must stop smoking prior to surgery. Next is reducing constipation. Pending your specific surgery, you may be required to perform a bowel prep prior to surgery. While not everyone is required to have a bowel prep prior to surgery, you will be more comfortable after surgery if you've had a full bowel movement prior to coming into the hospital. The surgery, anesthesia, and pain medications are all known for increasing constipation. Ideally, if you are constipated, you should have a bowel movement 2 to 3 days before surgery. Do not take any laxatives the night before or morning of surgery. Good nutrition will help get your body ready for surgery, heal better after surgery, and fight infection too. Eating enough calories, protein, vitamins, and minerals will all help speed your recovery. Here are some tips to get your body in good nutritional shape before surgery. Eat foods that will help your body heal. Good choices are protein-rich foods, whole grains, fruits, vegetables, and dairy products. Eat at least 3 times a day and don't skip meals. The next item is surgical clearance if needed. Our department, along with the pre-operative clinic, are responsible for contacting doctors and obtaining medical clearance. It's listed on this slide because often the provider wants to see the patient in their office before providing clearance, so we wanted to bring this to your attention in case you get a call trying to arrange an appointment. If you have any medical leave or short-term disability paperwork, it must be sent to the orthopedic surgery or neurosurgery office, pending your surgeon's respective department. While inpatient staff is part of the team, they do not complete this paperwork. There is someone designated in each clinic that communicates with your surgeon and fill out your paperwork accordingly. We also scan the completed paperwork in your chart and fax it wherever it needs to go. This keeps it all centrally located and easily accessible. You can drop off this paperwork to the respective department your surgeon is located at, fax it, or mail it in. Next is accommodations. For those of you that live far away, Michigan Medicine has a small hotel in-house called the Med Inn, as well as several nearby hotels that offer discounted rates. It might be easier for you to stay the night prior to surgery down here if you live several hours away and have an early arrival time for surgery. The phone number is on your screen to contact for reservations. It's 1-800-544-8684. If you're interested, we recommend calling as soon as possible for a reservation. Additionally, if you live far away and a friend or family member will be staying around here until you are discharged to be able to take you home, they also qualify for that discounted room rate as well. And lastly, consider post-surgery care options. This is done occasionally if it is felt you would benefit from additional therapy. This is decided by our inpatient physical therapists, discharge planners, and our surgical team. The main goal is for you to be safe at the time of discharge, whether that means going directly home or staying at a rehab center. We would like you to have an idea of your top 3 facilities you would like to go to, should the need arise. If you live at home or have minimal support, we may recommend placement in a skilled nursing facility for several days to several weeks. This will ensure your safety upon return home. Please check with your insurance company prior to surgery to see if you have coverage for home care or skilled nursing facility care. If services are covered, again, we recommend that you provide us with at least 2 to 3 names of facilities that you would be interested in going to. Asking for references from friends or family can be helpful to find out information about a nursing home prior to surgery. You may also go to the website www.medicare.gov, click on Find Care Providers towards the bottom of the page under Take Action, and select Nursing Home for a list of skilled nursing facilities in your area. Now, let's briefly talk about medications you need to stop taking prior to surgery. Remember, Each patient is going to get a detailed list with their medications with directions as to when they need to stop if it's applicable. In general, 1 week before surgery, stop taking any herbal supplements, vitamins, and over-the-counter weight loss supplements. You need to stop taking NSAIDs and similar medications like ibuprofen, Advil, Motrin, Aleve, Mobec, or Celebrex. You need to stop all recreational drugs, especially marijuana. The active ingredient, the THC, interferes with our ability to put you under general anesthesia and makes controlling your pain difficult after surgery. If you are on prescription blood thinners, such as Coumadin, Pradaxa, Eliquis, or Brilinta, do not stop taking these on your own. We are responsible to request the clearance for you to come off them from your prescriber. And continue taking all of your other medications as prescribed unless directed. This next slide discusses the importance of carbohydrate loading prior to surgery. Carbohydrates are rich in sugars and starches. Carbohydrate loading means consuming carbohydrates before surgery. Carbohydrate loading can decrease discomfort before surgery by reducing hunger, thirst, and anxiety. It can also help to decrease nausea and vomiting after surgery, help maintain normal blood sugar levels, decrease constipation, and shorten your hospital stay. You will be given specific instructions before surgery about what to eat and drink the day before and day of surgery, and when to stop. Your carbohydrate loading instructions will include consuming a certain amount of 100% pure, no sugar added, white grape juice. You will need to buy at least 36 ounces of 100% pure, no sugar added, white grape juice, no substitutions. You may need to buy a 64-ounce bottle or two 32-ounce bottles of the juice. In terms of instructions prior to surgery, the entire day before surgery, you may eat normally until midnight. Between 7 p.m. and 10 p.m., drink 24 ounces of the carbohydrate drink, the 100% pure, no sugar added white grape juice. The day of surgery, do not eat any solid food. This includes gum, candy, mints, and etc. after midnight the night before surgery. You may drink water or clear liquids up to 4 hours before your surgery start time. Clear liquids include water, black coffee or tea without cream or milk, Gatorade, clear juice without pulp, cranberry or 100% pure, no sugar added white grape juice, any pops or sodas. Drink the last 12 ounces of the 100% pure, no sugar added white grape juice on the day of your surgery. Aim to finish about 2 to 3 hours before your scheduled surgery time. You may need to drink it on your drive to the hospital, depending on the time of your surgery. If you are on a fluid restriction, include this amount of juice in your restriction. You must not eat or drink anything else except for water and the juice mentioned above. Now, let's talk about what to expect during your hospital stay after surgery. First, our inpatient teams round early, and you can expect a visit from us between 6 and 7 a.m. We like to see you early to be able to speak with you, examine you, evaluate you, and be able to make a plan for the day. We might need to consult physical therapy or case management, or even just to determine your discharge. Seeing you early prevents any delays in your care. Most of you will have a urinary catheter inserted in you when you're under anesthesia. This is usually removed before you wake up or shortly thereafter. We mention this because sometimes, after being catheterized, a patient's bladder gets somewhat stunned and the sensation to urinate is decreased. We will monitor you closely to make sure you have full sensation to void. Next is the incentive spirometer. After surgery and lying flat for a few hours, fluid can pull into your lungs and become a source of infection. It is important that you keep your lungs clear by using the incentive spirometer. You'll be directed on how to use it when you arrive to the floor. Basically, it makes you take deep breaths to keep your lungs open and healthy. Next is the use of heparin and SCDs. After surgery, you are at risk for blood clots forming. Some patients may require heparin, which is provided in small shots given in the stomach 3 times per day. While this is somewhat uncomfortable and can cause bruising, it is very effective in preventing a dangerous blood clot. We also use SCDs or sequential compression devices. These are soft, painless Velcro wraps that go around your lower legs and inflate and deflate to circulate your blood. Lastly, we encourage you to get up and moving. This may involve sitting up on the side of the bed initially, and then maybe moving to a chair. Our goal is to have you up and walking within several hours after surgery, assuming no contraindications. Early ambulation can help to improve blood flow, speed wound healing, improve lung function, enhance muscle tone, and help shorten the hospital stay. It may also help prevent complications including infections, pneumonia, blood clots, UTIs, and urinary retention. Let's talk about some common symptoms after surgery. Nausea is the most common symptom patients experience, and it's usually caused by the anesthesia or the pain medication we give. If you're nauseated, don't hesitate to tell us. We have medication to help with this. We don't want you not taking pain medication because you're afraid you'll get nauseous and vomit. We can give anti-nausea medication first, and then once that kicks in, we can give the pain medication. Another tip is to eat and drink really slowly after surgery to also decrease the chance of nausea. Another common symptom is constipation. It is common to be put on stool softeners after surgery to help you have a bowel movement. If you know you're prone to constipation, let us know. We can order whatever you need to help you go. And lastly is pain. Given the nature of surgery, you will have pain afterwards. We're going to monitor your pain frequently and ask you to rate your pain from 0 to 10, with 0 being no pain and 10 being the worst pain of your life. For the first day or so after surgery, you may have IV pain medication, but then we need to switch you to oral pain medication because ultimately that's what you will go home on, and we need to make sure that it's effective in taking the edge off your pain. In addition to medications, we can help you reposition yourself, get up to a chair for comfort, or even bring you an ice pack if you want to try that for pain relief. Moving on to discharge. Everyone watching this video is having a different surgery and their time in the hospital will vary. If your surgery is very complex, there is a chance that even going to rehab after the hospital stay is the best option for you. But most people are discharged home, and that criteria includes being able to tolerate a diet without any swallowing issues. While your throat is going to be sore, you are still able to swallow without coughing up or choking on any food or liquids. You're able to get up and walk around safely, or your mobility is at your baseline, meaning if you were using a cane or walker prior to surgery, you're able to use one safely afterwards. You're able to urinate without difficulty, and your pain is controlled on oral pain medications. This next slide is very important. It's your post-operative do's and don'ts after spine surgery. The first 2 is to walk around. Remember, you're at an increased risk of a blood clot after surgery. We want you up and moving. There is no bed rest at home after this surgery, and there are no walking restrictions. However, if you're having a bad day, the minimum recommendation is that you get up and walk around every 2 hours while you are awake. This does not mean you get up during the night to walk. We want you to get that healing restorative sleep, and this is only during the day. The next 2 is caring for your incision. The specifics for caring for your incision will be outlined on the next few slides, pending which department, either orthopedic surgery or neurosurgery, you had your surgery performed by. Now on to the don'ts. No lifting, pushing, or pulling over 10 pounds. That means no lifting laundry baskets, grocery bags, yard work, etc. There's no repetitive bending or twisting of your spine. Notice this says repetitive. Repetitive movements are like bending repetitively to pick up weeds, twisting to put away dishes in the cupboard, mopping, or sweeping. In terms of care for the incision, you cannot put any lotions or creams on it. This includes Neosporin, bacitracin, Mederma scar creams, and vitamin E. No submerging the incision in water such as a pool, hot tub, or a bath. If you are seeing a Michigan Medicine neurosurgeon for your surgery, your surgical dressing should be removed 48 hours after surgery. Do not cover the incision with bandages or dressings. Keep the incision clean and inspect daily for signs of infection, which includes increasing redness, increasing tenderness, increasing swelling, or drainage from the incision. Clean the incision daily. Clean by using a mild liquid soap. Do not use bar soap, which can contain bacteria and is often shared among family members. Gently wash your incision first, then the rest of your body. Use a clean towel each time you shower after surgery. When drying, pat your incision dry first, then dry the rest of your body, being careful not to retouch your incision. Please see the list of neurosurgeons on this slide. If your surgery is performed by one of the surgeons listed, the information on this slide pertains to you. If you are seeing a Michigan Medicine orthopedic surgeon for your spine surgery, leave your dressings in place until your first clinic follow-up appointment. The incisions are to remain covered at all times. You may shower if you are able to keep the incision dry. Cover with saran wrap or Glad Press and Seal or other waterproof resistant dressing. When showering, use mild liquid soap. Do not use bar soap, which can contain bacteria and is often shared among family members. Use a clean towel each time you shower after surgery. Please see the list of orthopedic surgeons on this slide. If your surgery is performed by one of the surgeons listed, the information on this slide pertains to you. Now, while we don't expect there to be any complications after surgery, it's still important that we talk about red flag symptoms to be aware of. You need to contact the department who performed your surgery immediately if your incision changes and becomes more red, swollen, painful, or hot compared to what it was at discharge. We expect some redness and swelling after surgery, but this should only decrease slowly with time. Next is if there is any drainage from your incision, we need to be notified, or similarly, if the incision opens, we need to be contacted right away. The next symptom is a fever over 101 degrees. While this actually might seem a little high, the natural process after surgery causes an inflammatory process, and it's common for your body temperature to elevate after surgery while you are healing. But over 101 degrees is not expected, and we need to be notified. If you develop any new symptoms that you did not have when you were discharged, such as increased pain, any weakness or numbness to your upper extremities or lower extremities, we need to know about that right away. And lastly is bathroom difficulties. If you suddenly lose control of the ability to hold your urine or stool, or if you have no sensation to go to the bathroom, we need to know. Now, if any of these symptoms occur, we need you to call the surgeon's office who performed your surgery. A lot of you like to use the portal system through MyChart, but do not send a message to us with a red flag symptom. It might not get looked at until the end of the day, and we would never want your symptom missed. We want them addressed immediately. There could be a wait on the phone before someone answers if you call us. Please be patient because your call is very important to us. But if you feel you need immediate attention and can't get through to us, please report to our ER, or if you do live far away, then to your local ER for urgent evaluation. Let's talk about pain medication and pain management after discharge. Pain is expected after surgery. Our goal is to keep you comfortable, but not necessarily pain-free immediately after surgery. According to Michigan law, we can only provide a maximum 7-day supply of pain medication at discharge. You are entitled to refills for up to 1 month as needed and will be weaned as deemed appropriate. In order to get a refill, you must call the clinic during normal business hours only, 8 a.m. to 4 p.m. Monday through Friday. We cannot refill any prescriptions after hours or on the weekends. This means you need to be aware of how much medication you have left and call us at least a day ahead of that time to request a refill. We do run a MAPS report on every refill request. This means we are able to see where you have opioid pain medication for any pharmacy. If you happen to obtain opioids from another provider during this time, we are no longer able to prescribe pain medication for you. This includes if you go to an ER for pain. We need to be the people you contact first. If you normally see a pain management physician, it is your responsibility to contact them before surgery to make a plan for prescribing medication, especially if you signed a medication contract with them. Some pain management physicians allow you to take the first refill from us, and then they want you to go back to them for further prescribing. That plan needs to be arranged ahead of time because we will only prescribe for a maximum of 1 month after surgery. After spine surgery, we will follow up with you for up to 2 years to evaluate your progress both physically and on imaging. Specific time points for follow-up depend on surgery type and may vary. If you don't have your first post-op visit scheduled before surgery, call your surgeon's office to schedule it. A typical post-operative visit schedule, either in-person or video visit, may include appointments at 2 weeks, 1 month, 6 weeks, 3 months, 6 months, 1 year, and 2 years post-operatively. We typically get x-rays before each visit. Contact information for the neurosurgery department is listed on this slide. If the surgeon who performed your surgery is listed below, please call the listed numbers to contact a person from their team. Contact information for the orthopedic department is listed on this slide. If the surgeon who performed your surgery is listed below, please call the numbers listed to contact a person from their team. If you have any questions, please ask your surgeon today, or you can contact the orthopedic surgery or neurosurgery office or message your questions in the portal. Thank you for watching this video, and thank you again for choosing Michigan Medicine for your upcoming spine surgery.